with our chapter 6 on bones, and last time we met we were talking about classifying bones by what they looked like, and we said we had long bones and short bones and irregular bones and subsequent bones, whatever, so we stopped there. And so now we're going to pick up a little bit here and talk about the parts of a long bone. And some of you already had seen a long bone from lab today. We had a humerus and a femur and things like that. And so long bones, we said they are longer than they are wide. And so we can give an example like a humerus over here. And you guys remember those parts of your humerus from lab today?
Yeah.
Yeah. Then that little rounded marble right down there is called your, supposed to see. Capitulum, good job. And then the V-shaped notch is the trochlea. Good job. So studying. All right, so anyway, so here's going to be our long bone. We'll go out and we'll select that through there. And since we have some structures or parts, what we're going to find is the ends of my long bones are called the epiphysis. So we have an epiphysis. Holy cow. I'm using my voice here. Epiphysis. Do I have two of those or one of those? Two. I have two ends, so I have to have two epiphysis. So they're on my ends through there. Okay. Now the shaft of the long bone over here is called the diaphysis. So I just have one of those. I have one shaft. And I have an area from here to there and here to here. So like the middle portion. This guy is called the metaphysis. So I'll do that word next. So my metaphysis. That word meta means like middle. You guys remember from like prophase, metaphase, anaphase, telophase, that cell division thing? Maybe you did like way back when maybe? Maybe you did, maybe you didn't. I'm not sure. Okay. So on my typical long bone, I have two epiphyses, two metaphyses, and one diaphysis. Sounds like a great test question, doesn't it?
Great test question?
Sounds like a great test question, yeah. So what we did is we took a picture of our bone and said, okay, well I have an epiphysis, a metaphysis, a diaphysis, all the way through there. So you may want to know that, where those things are located, and how many of those that we have. So it's looking pretty good. Maybe there's a question that says, name the shaft of a bone. Diaphysis. How many epiphyses do we have? Two. Things like that. All right, so those are my structures of the long bone. I have a few more things here for you. And again, we said there's that word metaphysis, in which we have two. So it's that narrow area between the shaft, or the diaphysis, and the epiphysis. A little thing that goes with that, it says we have growing bone. So your bones do grow, right? So they grow lengthwise and diameter and things like that. So it says growing bone, we have something known as an epiphyseal plate. So where do you think the epiphyseal plate is located? In the epiphysis, the diaphysis, or the metaphysis? One would think that, right? Because it's called the epiphyseal plate. However, it's in the metaphysis. Crazy, isn't it? So yeah, so the epiphyseal plate is the metaphysis. So you're going to make a note of that. That's where bone grows. Yes, lengthwise for us. So the epiphyseal plate is located in the metaphysis. And so we're going to find there's like a little chunk of cartilage right in there if the bone is still growing. So the metaphysis is the epiphyseal plate. Well, how do you look at that?
Well, like different things.
Yeah, sort of. Yeah, it's, you can say, a punch. Epiplate. Because like the metaphysis is like an area, and the epiphyseal plate is there in that area, so it's sort of like it is in ways, it's the same thing. So we'll go with that.
Is metaphysis IS or ES?
Yes. Yes.
Well, you
It's only
wrote
one
it
letter off, so you're right. Right?
but you're the
Yeah. ES, IS, I don't know. What do you guys think? One of those.
Yes.
One or the other.
I guess
Which
both
one's
would work.
like? Go with your choice. Okay, so we have the plate. So what I want you to know is that the epiphyseal plate means that bone is still growing, actively growing. How long do you grow bone? Until like what age?
14,
14. What if you're male?
16, 18.
Yeah, so it varies, right? So it depends on the individual, and also if you're male or female, also as what time do you start puberty and things like that. So there's a lot of different variations. that go there. But typically men, we grow older, right? We have more growth going, so we have longer for our bones to grow versus the female that has less time. So typically a male says, I don't know, around 18, probably, 18 to 20. And for the females, you guys around 16 to 18, probably in that range somewhere. So we have like a couple more years typically. 1, 2, 3, maybe. So usually females, by the time you're done like graduating high school, you're like done growing. Sound about right? Maybe, I don't know. And the guys, you have like a year or two to college before you stop growing typically. So just know that women stop growing earlier. Good thing to know. Men, we have a little bit longer by a couple years. We're going to find that hormones like estrogen and testosterone is what really affects this for us. And then when does puberty start for most people?
14, 13.
No, 13, 10.
Yeah,
10 or 11.
10.
12.
Some kids
Yeah.
No, it's getting younger now.
It is getting younger.
Yeah,
Oh, yeah.
Depends on hormones and-
Yeah, kids are like 12 having babies. It's like crazy.
7.
Yeah, 7.
Yeah.
Did a baby at 7?
No, my sister worked at Tampa General, and in the mother baby unit, there was a 7-year-old pregnant with twins.
Take it out of 10. Shut the front door.
So yeah, that's like way young, right? Yeah. All right, so we're going to find then for growing bones called the plate. And when we stop growing, it changes the name to the epiphyseal line. The epiphyseal line. And really, I'll show you the differences on them too. So bone is actively growing, the plate. When you're done, it's called a line.
It becomes
A line.
an epithelial.
Epiphyseal line. Okay. That's a vision to show you. So typically, here's what it's going to look like. So here's a bone that is still growing. We'll go up here like this. Here's my plate, which is actually a little chunk of cartilage. So you can actually see that on an X-ray of the cartilage. And then if you stop growing, your bone looks like this. There's a line. You actually see the line too. So the plate, actively growing, line, stopped growing. So we'll do more like bone growth and steps of bone growth and all that. That's the difference between the two. Okay, what else do we have for you? Not good.
Is it all bones that stop growing in the body, or is it just a few bones that stop
This is going to be, well, your long bones work this way. Are growing lengthwise. Right, well, there you go. Things like totally locked up there. Okay, so do you guys remember from lab, where do I find hyaline cartilage?
Need a long bone.
Sort of. We say it was like fetal skeleton,
Was it there?
baby bones, right? So fetal skeleton, hyaline cartilage, also on the ends of long bones. That was our answer. Okay, so we're going to find something known as the articular cartilage. What's an articulation? A joint, right? Like a knee joint, a shoulder joint, an elbow joint, whatever. It's called an articulation. So articulations are joints. Finger joint, wrist, whatever it's going to be, right? Joint for us. And we're going to find a little bit later on that all of your bones, most of your bones, I should say, started off as a chunk of hyaline cartilage. We started off as a chunk of hyaline cartilage, and then that cartilage gets converted to bone tissue. So it's a little conversion thing. In the process of that, we're going to find at the very end, when my bones are all done growing, I have a little remnant of hyaline cartilage left over on the ends of my long bones, i.e. that's why I found hyaline cartilage on the ends of long bones, and I just changed the name to articular cartilage. So articular cartilage is hyaline cartilage found on the ends of my long bones that helps to reduce friction for the joint. Good? Okay, so hyaline cartilage covering the ends, right, my epiphysis of my bones. Well, that says that should be epiphysis, right? Yeah, so cross that off, put epiphysis through there. It helps to reduce the friction in joints.
And you put the
Yeah, it should
caries.
not say diaphysis, it should say epiphysis. That's the ends of the long bones. The shaft is the diaphysis, so I'm not sure it's like a typo somehow. We saw that.
So it reduces or
Yeah, so here's the epiphysis, right? Here's my little epi. Here's the under too. Here's my shaft, that's the diaphysis. And in between is the meta. Next thing, so it's gotta be epiphysis. Okay, so that's articular cartilage. It's hyaline cartilage. Okay, question 2. You never know. Okay, periosteum. What's it sound like? Peri, around, osteo, bone. Okay, so your periosteum goes around the bone. It's like a wrapping or a covering that goes around the outside of your bone called the periosteum. They talk about what it looks like. So this layer of this dense, irregular connective tissue covers the entire bony surface except for the articulating surfaces. So you don't want to have like this periosteum around the cartilage because it sort of defeats the purpose of the cartilage. So we're going to find that I have all this periosteum, right? It covers the entire bone all the way around, 360 degrees, all the way except for, and it stops right there, right? Except for my articular cartilage. That's the periosteum. So why the heck do I have to have this covering around my bone? For a
protection.
few things. I need it so I can grow the bone in diameter, also for fracture repair, also for tendons and ligaments to be able to attach to the bone as well. So it's pretty useful stuff to have this periosteum. So maybe I want to jot down some of the functions of your periosteum. Allows for bone growth in diameter, helps to nourish the bones, I get some nutrition to there, protection, fracture repair, attachment point for tendons and ligaments. Sounds like a great test question for that one too. Let's throw that out there for you. Give me one of that one, that's for sure. Okay. So yeah, so this little bit of covering around my bones. Can you, I'll ask you this question too. Have you ever had like ultrasound therapy done? Ultrasound, gel, fucking gel, shoulder, electrolysis, things like that, whatever. So why do you have to like move that little ultrasound head then? So here's a little ultrasound unit. This little handle. Yeah, it's like plugged in, right? And then with a little coupling gel in there. Yeah, little sound waves come through here, right? Goes through your muscle tissue, depending on the wavelength and that good stuff. So it's like a deep heating thing. So the reason you have to like move it, you can actually burn the tissue. You don't, you like sit down there like forever, or you like nice little burn through there. You have to like move it around. It's so like deep penetrating that you can actually burn the periosteum off of somebody's bone. You like pull it out for like one spot. Yeah, maybe like real happy if you burn the periosteum off the bone. That hurts like a yeah. For a really long time, it's not gonna be like real happy with you. So make sure you keep that thing moving around, otherwise it's gonna be like really bad. So yeah. I always like to know about periosteum too. On the outside of the bone. A couple more parts. We have the medullary cavity, like bone marrow. We're going to find that because your bones, your long bones are hollow on the inside. So you have some sort of cavity on the inside. You go ahead and stuff that full of marrow, like yellow marrow or red bone marrow. So we really want to put through there. And then you have something known as the endosteum. That's what? A covering on the inside. So endo, meaning within, osteo, bone. Okay, so you have this covering on the inside around the medullary cavity. So let's see what that looks like. So I take my little bone, let's draw like a tree bone here real quick, and I chop it in half. And I look from top to bottom. I'm going to find my bone is nice and round, and then I have this medullary cavity. Inside is my bone marrow. I can fill that up with a little bit of bone marrow. And then I have the covering. So I have this covering that lines the inside around my medullary cavity. That's called the endosteum. And I have a layer on the outside of the bone called the periosteum. That's always a test question too. Like endosteum versus periosteum. Where is it located? What's it around? Things like that.